All right, so unoxygenated blood comes from the lower body here through the inferior vena cava, and from the upper body here through the superior vena cava, comes down here into the right atrium. And then the blood flows through the tricuspid or the atrioventricular valve right here into the right ventricle. And the atrioventricular valve is actually held in place by chordae tendineae, which come down here, and they're like fiber that comes down here and attaches to the papillary muscles in here. And then from there, the papillary muscles also pump blood out through here into the pulmonary semilunar valve, which comes up here into the pulmonary artery trunk. And the trunk splits into two and goes to the two different lungs, which are on either side of the heart. And then there the blood gets reoxygenated, and then the oxygenated blood comes back in through the pulmonary veins and flows in here into the right atrium, which is the smallest chamber of the heart. And then it flows through here, the mitral valve, which is also held in place by chordae tendineae. Flows through here into the left ventricle, which is surrounded by really big muscles, and the really big muscles pump the blood out through the aortic semilunar valve, which is right here. And the coronary arteries are actually in this area, and they stem off here and give blood to the heart itself. And the two ventricles are actually separated by the intraventricular septum. Yeah, the intraventricular septum, which is this little part right here, separates the two ventricles. The blood then comes out through the aorta, splits into three up here and goes to the upper body, and then the blood for the lower body comes down through here through the lower section of the aorta. And the heart is also surrounded by the pericardium, pericardia, which is kind of like a fluid sac that covers the heart and makes sure there's no friction against the lungs, so there's no damage or anything. Two things I liked learning about the heart is that the heart can actually pump blood without the brain, using with the node that's actually right in here that sends the electrical signals out through all the muscles. And also, the blood takes 2 or 3 times to get through the entire body. It's not just one pump and then it all comes back in. Can't fit all the blood in the heart. And then one question I still have is, does the size of the left ventricle play a role in the amount of blood that gets pumped throughout the entire body?